Hey everyone, my name's Sarah Lavonne and welcome back to my YouTube channel. Today I am going to talk all about gestational diabetes, what it is, what the symptoms are, and then how you're tested and why we care about it. I felt like I needed to split this into two videos because I'm trying to keep these as short and sweet as possible given my long-winded self. So this one is going to be pre-testing, before you've been tested, during your pregnancy, and then I'll be back with part 2 of what happens if you test positive, talking to all you mamas who either tested positive or are concerned about testing positive, and then what to expect for the rest of your pregnancy and birth. So don't forget to subscribe so that you don't miss that video, and then let's get started. So let's talk all about gestational diabetes because you guys have been asking about it, and I know that this can be a very big area of concern for you guys. I do want to just side note that this is the first of many of the kind of like complications of pregnancy videos because I'm starting to move that direction. So if you have other complications of pregnancy that you want a video about, throw that in the comment box down below. I'm starting with gestational diabetes because we know that all of you likely are going to be tested for it. So I want you to know what to expect. And then if you were positive, that's part 2. So stay tuned on that one, okay? So what is gestational diabetes? Gestational diabetes, short and sweet, is basically that you have diabetes just in pregnancy. So you didn't have diabetes before, you get pregnant, and for whatever reason, your body doesn't process sugar or carbohydrates as well as it did before, increasing your blood sugar. So what happens in your body when you have gestational diabetes / what happens in your body when you don't have gestational diabetes and you eat sugar? So we're gonna eat sugar. I'm gonna have something sweet. I'm gonna have a candy. I'm gonna have a piece of bread, some sort of carbohydrate. And carbohydrate, I think when we think of sugar, we think of like sweet things like ice cream, which sounds really good right now. But I'm actually talking about things that you can eat that turn into carbs. So if you look on like the label of your food, you can look at the number of carbs, and if the carbs are higher than other things, if it's a meat, it's a protein. Those are kind of like, you can look at your food pyramid and learn mostly breads, and then sugar, sweets, fruits and vegetables sometimes have carbs in them. So we like carbs. Carbs fuel us. They keep us going. We need sugar to have energy, right? But the difference with gestational diabetes is you eat the sugary food. Let's say I have a piece of white bread. I eat the bread, it absorbs, the sugar gets absorbed into my bloodstream, and then normally my pancreas is going to get triggered and say, hey, release a little insulin stuff, and that's gonna be released to lower my blood sugar so I don't have all this free-flowing glucose in my sugar, and then the sugar can actually be turned into fuel for your body. When you have gestational diabetes, you either have insulin resistance or your pancreas isn't producing that insulin to help lower the blood sugar. So it increases your blood sugar in your body. So it's like, hey, I can't bring the sugar down, so now my blood sugar is higher, so I have extra sugar, which either causes more insulin to be released, so your insulin levels end up being really high, but they're not actually affecting your sugar, or you have an impaired way of creating insulin, so you can't actually lower the sugar. Kind of two sides of the story. We're gonna go with you can't lower your blood sugar, okay? So that allows for increased sugar in your blood. Now, for pregnancy, we particularly care about this because you have a baby in there that you're trying to grow, and that sugar or the nutrients that you eat are helping to fuel and grow the baby. When your sugar is high in your bloodstream, that does pass through the placenta to the baby, and then the baby has increased blood sugar as well, causing their pancreas to produce more insulin to help keep that sugar regulated. And with that free-flowing glucose and that increased insulin, that is going to potentially put your baby at risk for being a lot bigger because insulin equals more weight gain. So I could, like, if I gave myself insulin, I would gain weight whether I was eating or not. I hope that makes sense. We're really getting technical here, okay? So moral of the story is your baby's at risk for being big, which we will talk about when we get to labor and birth and the effect of that in part 2. So the risk factors for gestational diabetes are gonna be mostly if you're overweight or obese going into your pregnancy. So note to self, I talk about this in my Trying to Conceive video, that it is important if you can to regulate your weight going into pregnancy. It's gonna cause less complications for your pregnancy, less risk for your pregnancy, which we love, okay? If you are over 35, particularly over 40, you have a family history of diabetes, or you have a poor diet, like you're eating a lot of processed foods, a lot of sugar, that you're mostly eating carbs, that's gonna put you at risk for diabetes. So your doctor, they also know your history. If you've had a history of diabetes or like scares with diabetes, or particularly if you're overweight, they may test you earlier in your pregnancy. But otherwise, typically for the average person, you're going to be tested between 24 and 28 weeks. Now, what does the testing look like? So the testing would be you come to your doctor. There's 2 ways of doing it. They can do a fasting blood sugar. So they would tell you ahead of time that you need to not eat anything for a certain number of hours. Usually it's 8. And then you don't eat. They come in, they have you drink some sugary water, and then they prick your finger, they test your blood sugar. And if it's high, that can be a, maybe we have a gestational diabetes on our hands situation. Now, the more common way of testing you is a 2-part. Well, it's actually like 1 part, and then if you pass the 1 part, then you don't have to do the 2nd part. So normally you don't have to come in fasting. You would just come in for your 24 to 28 week appointment. They would give you some sugary, nasty sugar. It's like not even that sugary. It's kind of like Pedialyte, but sweet. So sugary water with a specific dose of sugar in it. You drink it, you wait an hour, and then they test your blood sugar. And if it's high, then you would go on to the 2nd step. But if your blood sugar is normal, that means your pancreas, your insulin is working well to regulate your sugar when you eat. Your sugar is regulated by that hormone to lower it, and then it's not an issue. Now, if you fail that, I will just say that that is pretty common to fail the first one. So if you fail the first one, by fail, I know that sounds horrible, but like if you don't pass the first one, take a deep breath. Just expect that you're gonna have to go back for the longer one, which is a 3-hour test. But then most of the time you're gonna be negative. Now, as far as statistics go, worldwide, gestational diabetes is about 17% of pregnancies worldwide will have gestational diabetes. In the United States, the number is about 6%, flex and flow. So about 6% of you in the US will have gestational diabetes. And if you do, we'll talk about that in part 2 of how your life changes and how the rest of your pregnancy looks. But for now, if you fail the first one, you'll come back for the 2nd one. They'll give you a little bit more sugar in the 2nd one. They'll wait 3 hours, test your blood sugar, and then that is the actual diagnostic test. So until you've failed the 2nd one, meaning your blood sugar is too high after taking that 2nd drink of the orange nasty, it's not that nasty, but it's not very good either, drink, then you don't have gestational diabetes yet. But if you don't pass it, then you do. Some people will ask me about a fasting glucose. So like you just come in, they test your blood sugar, or an A1C test, which is a blood test that you can do to see like over a long term or a long amount of time how your blood sugars have been regulated. That's very common to test regularly when you have just a regular diabetes. But those both aren't very predictive of gestational diabetes. And so typically they're not gonna do that unless they have like they're suspecting that your blood sugar is high or low in the office or something, just to spot check. So typically you can expect the 2-part test, maybe the 1-part test, but probably the 2-part test between 24 and 28 weeks of your pregnancy. Now, if you are at home and you are feeling some symptoms, you're maybe feeling kind of weird, these are the signs that might indicate that your blood sugar is running high or you're having a hard time lowering your blood sugar. So first of all is increased thirst. That is super common for just diabetes in general. So even if you're not pregnant and you're just like, I am thirsty all the time, I'm peeing all the time, that those are 2 very indicative things that could mean diabetes. There's something to bring up to your doctor. So thirst, frequent peeing, and frequent peeing is kind of like dumb for pregnancy because like you already have frequent peeing. So this is like you just peed and then you're drinking a ton, so you're peeing again, more so than like a regular pregnancy thing. But that one kind of to me goes on the back burner because you're just gonna be peeing a lot anyway. Recurrent infections are also something else to pay attention to, because when you have increased blood sugar free floating through your body, infection loves to eat sugar. So if you have extra sugar around, you may have some recurrent infection. So let's say like particularly in your vagina, like yeast infections, bacterial infections in your vagina, because you have that bacteria that's being fed and kept alive by all the extra sugar. And then any kind of vision changes. So vision changes are also a sign of preeclampsia. Another video coming at you sooner or later. But vision changes, like you kind of feel this like dizzy, hazy, spotty, blurry situation where you're like, I don't have a headache. And headache with vision changes is more indicative of a preeclampsia or a high blood pressure in pregnancy. But if you have kind of a combination of that, particularly the thirst, it would be a reason at your doctor's appointment to say, hey, you know what? I've had these symptoms. Would it be worth it to test for gestational diabetes now versus later? And you can kind of flex and flow with your doctor on that one. So why do we care if you are positive for gestational diabetes? Because it puts you at risk for other things in your pregnancy for yourself and then also for your baby. So long term, if you've had gestational diabetes, you do have a higher risk of heart disease, mamas, and basic diabetes, like diabetes mellitus, just diabetes in life, rather not being related to your pregnancy. And then for baby, long-term, we wanna know because they do have an increased risk of heart disease, also diabetes, and then obesity. There's a correlation with the two. So not only for long-term, you wanna know if you have this going on, but then also for treatment, because it is important. Your blood sugar is so essential for life. If your blood sugar is too low, that can cause massive complication. And then if your blood sugar is too high, that can also cause massive complications. So ketoacidosis, kidney failure, I mean, like major problems that we just want to avoid. And we can by actually treating. So we want to know, and then you're going to want to respond. Now, if you are positive, the risks for your pregnancy, again, I know recently I've been talking all about risk factors, and these are the things that are gonna put you at higher risk for this happening in the future, or you are at higher risk for it happening, depending on which side we're talking about here. And so the risks, if you're positive on your pregnancy, are gonna be preterm birth. You have a higher chance of a preterm baby, big baby, which you can imagine because of that free-flowing sugar in the blood and then insulin, and that just causes the baby to kind of bulk up a little bit. Placenta abruption, stillbirth, and then the baby has low blood sugar after delivery. So I'm gonna get into that more in part 2, but I wanna make sure it's all laid out now so that in part 2, we can just talk about the impact on your pregnancy. So expect to be tested usually around 24 to 28 weeks. If you're positive for the first test, the 1-hour one, don't stress about it. Just expect to come back with a book or your phone or something to do for that 3-hour test. You're gonna be there for a second. And then if you're positive for that one, it would mean that you have gestational diabetes. Newsflash for part 2, it is curable by having the baby. So that gestational diabetes goes away after you deliver the baby, but we wanna pay attention because it puts you at higher risk for other things in the future, and there are ways to lower that risk to prevent future diabetes and then also prevent complications with your pregnancy. So in part 2, I'm gonna get into what the rest of your pregnancy looks like if you are positive for gestational diabetes, and then going into your birth, kind of what to expect for that, and then maybe some complications that could arise because of it. But in general, guys, this is not the end of the world. It's nothing to stress about. Remember, increased stress is not good for your body either, and so we wanna decrease your stress, know what you're getting into, and don't cross that bridge until you get there. And when you do, come back for part 2, and then you can learn all about it, how to decrease your risk and have a more positive, healthy birth memory. Thanks everyone for being with me here today. If you want more from me, you know the spiel. Everything's in the description box down below, but I have childbirth classes, coping with labor, VBAC, other resources over on my website. If you want more education, I have other stuff going on Instagram. Hit me up. I work with people from all over the world and would love to continue to walk alongside of you to help you have the most confident, positive birth memory and leading into your postpartum parenting experience. If you haven't subscribed already, make sure you do, because you know I'm gonna be back for part 2 on gestational diabetes. And then don't forget to flex and flow, and I will see you soon. Bye. Stand by. Oh, how's the roll? Because my pants are coming. They're rolling around in there. I'm very concerned about my roll. Yeah, that's fine.
What about this?
About my roll? I don't care. Oh yeah.
Okay, I just do that.
My roll, my vagina, my butthole, like I don't care. All of it.
Oh my gosh. All right, you ready?
No. A test called your A1C. It's not your HA1C. It is kind of your HA1C. Okay. This is a candid conversation all about Sarah's internals. No, there's more holes. Some people will ask me, pause. We'll talk more about that in part 2 because that's a whole nother thingling. No. Thing-a-ding. I don't even know what that is. A thing-a-ding. Oh, thank you. I'm glad you do. Somebody does. You can put a subtitle on that one. I hope that makes sense. I got ear holes, nose holes, mouth holes, eyeball holes, pores, a positive attitude. I'm just rambling and not even saying things that I don't even know what I'm saying. I'm getting into like way too much, going on and on. Let's try that again. Okay. Yeah. I'm aware. I'll move my hands.
Yeah.
So far, so good? Does that make sense? That's good. Right? Okay. Oh no. Oh no. Okay. Expect some fun things. I'm so fun. I got stuck. You can give me an email. Give me an email. Who gives an email? Happy life, happy people, happy. Why do I keep messing up the ending? Dang it. Trying again. Fun edits. Sorry. I'll pull this one out of me. I'll pull it out. Pull it out like a baby. Pee hole. I didn't talk about my pee hole. Okay.
Yeah.
I warned Jamie that you're gonna have to just get used to that because one of these days I'm gonna throw a Kegel ball in and it's gonna be a real and exciting video.